How were hospitals invented? Statistics show that by 2026, the number of hospitals worldwide is projected to reach an astonishing 215,977. That's a huge step from today, where the United States alone has 6,093 hospitals, helping millions of people every year. But have you ever wondered where it all began? Believe it or not, the idea of a hospital started way back in 4000 BCE. So, how did it all start, and what has changed since then? You'll be surprised to see how different those old hospitals were. Now let's dive into the video and explore the history of hospitals. When we talk about ancient history, we come to know that religion and medicine were closely connected. For example, in ancient Greece there were special temples called asclepiae. These temples were not just places of worship, but also centers where people sought medical advice, treatments, and healing. They were carefully designed to help people recover, providing peaceful environments that supported health and wellness. One famous example is the Asclepieion of Epidaurus. There, marble boards from 350 BCE tell the stories of about 70 patients who came seeking cures. These records share details about illnesses, treatments, and even surgical procedures, like removing abscesses or foreign objects from the body. It's amazing to think that they used substances like opium to calm patients during surgeries. The idea of combining spiritual rituals and medical care spread to the Romans. They even built a temple for Aesculapius, the Roman version of Asclepius, on Tiber Island in 291 BCE. Later, in Sri Lanka, Brahmanic hospitals were created as early as 431 BCE, making them some of the earliest known centers for medical care. Meanwhile, King Ashoka, a renowned Indian ruler, helped advance healthcare by establishing a network of hospitals in India around 230 BCE. These hospitals provided care and healing to the people in the region. By 100 BCE, the Romans began establishing their own hospitals, which they called valetudinaria. These were designed specifically to care for sick or injured soldiers. The health of the soldiers was essential because the strength and success of ancient Rome depended heavily on their military legions. All these were ancient beginnings, but the modern idea of a hospital took shape in 331 CE, during the rule of Roman Emperor Constantine the Great. After converting to Christianity, Constantine abolished the old pagan hospitals, clearing the way for a whole new perspective on caregiving. Back then, illness often left people cut off from their community, but the Christian approach changed that completely. It encouraged strong community bonds and made caring for the sick a shared responsibility among everyone. Around 370 CE, St. Basil the Great built a groundbreaking facility in Cappadocia. It had an isolation unit for people with leprosy, along with shelters for the poor, elderly, and sick. Inspired by this example, more hospitals were eventually constructed throughout the Eastern Roman Empire. Then, in 542, the Hôtel Dieu of Lyon opened, followed later by the Hôtel Dieu of Paris in 660. Now, please don't consider them hotels. They were hospitals with a unique focus. Caring for the soul of the patient was considered just as important, if not more, than treating physical illnesses. Monks played a key role in shaping hospital care during this time. Within monasteries, they cared for their sick in special infirmatoriums, which were equipped with a pharmacy and often surrounded by gardens filled with medicinal plants. These monasteries also welcomed travelers and pilgrims in need. During the Middle Ages, religion remained the primary driving force behind the establishment of hospitals. The Crusades, which began in the late 11th century, led to the establishment of even more hospitals. With disease often being a greater enemy to the Crusaders than battle itself, military hospitals were set up along the routes. One of the most famous was the hospital established by the Knights Hospitallers of the Order of St. John in 1099 in the Holy Land. This remarkable facility could care for around 2,000 patients and focused on helping those with eye diseases. It stands out as possibly the first specialized hospital and led to traditions that continue today through the St. John ambulance. The 12th century was an exciting time for the growth of hospitals across Europe. During this period, the number of hospitals increased rapidly, influenced by pioneering Arab hospitals in cities like Baghdad, Damascus, and Cordoba in Spain. These hospitals were remarkable because they welcomed patients regardless of their religion, race, or social standing. One standout was the Hospital of the Holy Ghost, founded in 1145 in Montpellier, France. It quickly gained a reputation for excellence and became a major center for training doctors. Many of the new hospitals built during the Middle Ages were established by the Benedictines, who are said to have founded over 2,000 institutions. By the late 15th century, cities and towns across Europe supported healthcare facilities, with England boasting nearly 200 establishments. Over time, responsibility for hospitals began moving from the church to secular authorities, especially after King Henry VIII's dissolution of monasteries in 1540. If we talk about hospitals in North America, the very first hospital, called Hospital de Jesus Nazareno, was built in Mexico City in 1524 by the Spanish conquistador Hernán Cortés. Amazingly, this historic structure still stands today. Not long after, in 1639, the French built a hospital in Quebec City, Canada, called Hôtel Dieu de Précieux Sang. Although it no longer exists in its original location, the hospital is still in operation, now known as Hôtel Dieu de Quebec. Then came a time when England faced the challenge of caring for the sick and injured without the help of monastic hospitals. This led secular authorities to take up the responsibility, and that's when the voluntary hospital movement started. The very first voluntary hospital in England is believed to have been founded in 1718 by French Huguenots. Soon after, more hospitals appeared in London, including Westminster Hospital in 1719, Guy's Hospital in 1724, and the London Hospital in 1740. The idea quickly expanded beyond London, with at least 18 cities across England establishing their own hospitals between 1736 and 1787. Scotland joined the movement too, opening its first voluntary hospital, the Little Hospital in Edinburgh in 1729. In the mid-19th century, hospitals became more organised and professional. The management of hospitals shifted toward structured systems with clear administrative rules. This period also saw major developments in medical education. The Apothecaries Act of 1815 required medical students to gain hands-on experience by training for at least 6 months at a hospital. A great example of this growth was the establishment of Charing Cross Hospital in 1818. Originally called the West London Infirmary and Dispensary, it was founded thanks to the efforts and funding of Dr. Benjamin Golding. By the late 19th century, hospitals were evolving into what we recognise as modern institutions today. Both public and private hospital systems experienced rapid growth during this period, enabling them to provide care to a larger number of patients. By the 1870s, the number of patients treated in hospitals had more than tripled from an earlier average of 3,000. In many parts of continental Europe, new hospitals were often funded and managed using public money, which helped to make medical care more accessible to the public. For France, the profession of nursing took a major leap forward by the early 20th century. At that time, the country had around 1,500 hospitals, many of which were run by 15,000 nuns from over 200 religious orders. However, after 1900, the government introduced policies to make public institutions more secular, aiming to reduce the influence of the Catholic Church. This created a challenge because many hospitals were outdated and relied on nuns for quality care. To address this, the government established new nursing schools to train non-religious nurses, preparing them for leadership roles in healthcare. During the First World War, a wave of women from middle-class backgrounds volunteered in military hospitals, eager to help their country. Though most left these roles after the war, their efforts raised the respect and importance of the nursing profession. By 1922, the government recognized this growing field by creating a national nursing diploma, ensuring nurses were properly trained and certified. As for the US, hospitals experienced massive growth in the early 20th century. By 1910, there were 4,400 hospitals across the country, providing 420,000 beds for patients. These hospitals were run by different organizations, including city, state, and federal agencies, churches, non-profits, and for-profit businesses. Religious groups played a key role, with all major denominations establishing hospitals. For example, Catholic hospitals were especially prominent, with 541 facilities by 1915, mostly staffed by dedicated, unpaid nuns. Alongside these non-profits were large public hospitals in major cities and research hospitals connected to medical schools. One standout example is the New York City Health and Hospitals Corporation, the country's largest public hospital system, which includes Bellevue Hospital. Over the years, effective techniques and advanced technology have greatly improved the quality of medical care in hospitals. This includes the use of X-rays, MRIs, CT scans, and other imaging technologies to aid in diagnosis and treatment. Additionally, the development of new medications and treatments has greatly expanded the range of conditions that can be effectively treated in hospitals. Today, there are around 215,000 hospitals in the world, and they continue to play a crucial role in the healthcare system. If there were no hospitals, many people would not have access to the necessary medical care they need. So, this was a detailed history of hospitals and how they have evolved over time to become the backbone of modern healthcare. As you can see, it has been a long journey filled with challenges and innovations. Unlike the past, hospitals are not just places to treat the sick. They have also become hubs for research and education. Let us know in the comments below what you thought of this video. If you enjoyed the video, make sure to like and share it with your friends, and don't forget to subscribe to our channel for more exciting content.